嗨，各位你好，我係林永嫻阿 Wing 啊。今日咧就宣眾要求，有真係好多人都由我一開始 Day One 到而家咧，已經問緊我你可唔可以講多啲保險啊？因為咧美國唔直都要買保險㗎啦，你知啦，同埋又好複雜㗎，真係好難明嘅。咁而我都唔係即係識好多啊嚇，我所以揾一個專家要嚟同大家解釋。今日咧就揾咗 Senior Wing，佢咧就係President 同埋 CEO。嘅娃娃 Financial Insurance Service Company， 佢已經有24年經驗㗎啦。而家係 specialize 係好多 area， 有 financial 啦，有 education 啦，有 retirement 啦，有 auto， 有 school 啦，又有 real estate， 所以你差唔多係 cover 晒所有生活嘅問題都可以問佢嘅。Welcome to Cynthia Ring. Thank you for taking the time to explain a lot of complicated health insurance question for us. It's really hard to understand, and also it keeps changing. It's really hard to keep it up. I know you need an expert like you to explain it to everybody. I know you specialize a lot of different area, and could you explain like the background, how the healthcare system work to us?
Yes, thank you. The healthcare system before 2010 was privately owned and operated by many health insurance carriers out in the United States. Before 2010, healthcare was probably about 1/3 to maybe half the cost of what healthcare is now for each individual, due to the reason that before 2010, each person who gets healthcare has to be individually underwritten for their health status. They can be denied, they can be requested to increase their premium. But after 2010, everyone is eligible for health insurance regardless of their health status, even if they have cancer, have been in the hospital, have pre-existing condition. They cannot be denied or have different premium than a healthy person.
OK， 咁Cindy 話咧就2010年之前喺 Obamacare 咧嗰啲 healthcare system 咧就係冇咁貴嘅，個價錢差唔多係1/3平好多嘅。咁因為咧就嗰陣時，如果你買 insurance 咧 ，insurance 公司要 screen 你嘅 health 嘅。如果你健康嘅咧就容易買啲，唔健康可能會 reject 你都得嘅，即係唔係人人可以買到 health insurance。但係2010前以後咧 ，Obamacare 有咗呢個 Obamacare 之後咧，就佢insurance company 唔可以 deny 你。即係唔可以話 say no to 你嘅 health insurance， 佢一定要買，你嚟買佢一定會俾你嘅。咁變咗咧嗰啲 cost 咧就係即係我哋要承受多啲 cost 啦，所以每一個人嘅 cost 都會貴好多咯。
But the premium probably has leveled off. It has not been increasing as much per year from maybe 2016 until now. But the insurance, on the plus side, it has actually become less complicated. Before Obamacare, there was many plans. Each carrier had maybe 30 to 40 different plans, different options. But because of Obamacare, they have simplified everything. Now the insurance is basically split into 4 tiers: bronze, silver, gold, and platinum. Each tier, from the lowest bronze to the highest platinum, is a deciding factor on how much you pay out of pocket. The less premium you pay, the higher out of pocket. More premium you pay, less out of pocket.
OK， 咁佢Sylvia 咧就話2016之後咧嗰啲 cost 咧就冇增加得咁多啦，最貴就係2010至2016嗰陣時，咁而家咧就平咗好多啦。咁咧就係以前就有個咪有 Obamacare 咧嗰啲 insurance plan 係好複雜嘅，有30至40個 plan 你揀。係即係揀到你頭都暈埋嘅，但係而家就簡單好多啦，主要有4個 level。第一個 level 最高嘅咧就 platinum， 跟住第二有gold，有 silver 同埋有 bronze。咁最高嘅 platinum 咧就係你每個月俾多啲錢啦，但係個 insurance cover 亦都會多啲，咁你就 out of pocket 咧就會少啲啦。咁最低嘅 bronze 咧就係你每個月唔使俾咁多，但係個 coverage 咧就會低啲，咁你 out of pocket 又會多啲啦。
However, regardless of what you pay, I think everyone should feel safe to know that there always is a cap. It doesn't matter between the bronze plan to the platinum plan. Between bronze, silver, and gold, your cap that you would ever pay within 1 calendar year at most is $8,000. So anytime, it doesn't matter how you pay first before company share costs with you. As long as out of your pocket is $8,000, you are covered at 100% for the year.
Oh, wow. Okay.
So even though premium expensive, but you are protected. So if you have $1 million bill, $8,000 is your cap, the rest will be covered.
Oh, wow, great. OK， 咁for plan blonde silver 同高咧，佢有個 cap， 你一年最多可以會用幾多錢？就係8,000蚊。你每年唔會高，你嘅 out of pocket 唔會多過8,000蚊嘅。咁insurance 會 cover 100%嘅。
And you know, as long as the healthcare professionals, as long as they deem that you can be treated, there's still hope for your sickness. In the US, they will always give you treatment and give you medicine. Unless they decide that any kind of treatment is no longer useful, then they will stop all treatment. So there is no cap to the money that they will pay for you, as long as there is a hope for the treatment.
Okay. 如果你需要 treatment 咧，個insurance company 就會係幫你去做呢個coverage 嘅，佢唔會 reject 你話唔俾呢個 coverage 你嘅。
And then for platinum, the maximum out of your pocket, because a lot of times platinum is almost double or a little more than double than your bronze or silver plans. Their cap is $3,000 for the patient responsibility. Over $3,000, insurance company will fully be responsible for.
Oh, OK。咁 platinum 咧就係你每個月差唔多要俾 double 多過bronze 啊、silver 同埋高嘅。咁但係你 out of pocket 係3,000蚊啫喎，唔係8,000蚊。咁其實慳咗2倍喎。Is it better plan in platinum? Because you pay double, but your coverage is like almost save 200%, right?
Exactly. So that's where we come. A lot of people say, well, I want to buy the best plan. But if you have a good consultant, they will tell you maybe you don't need a best plan. Because if you're healthy, you know, you'd rather save the premium. Now, if you get sick, you basically pay back what you saved.
Yeah,
because you are capped at 8,000. So you're smart, you know insurance.
Well, listen, I'm kind of know, like, hey, this doesn't make sense when I look at the number. Well, I'm accounting, I'm a CFO, so I'm really sensitive to the number. I'm like, hey, if I make a plan, I will buy platinum. You know.
Sometimes people, maybe they're having a baby.
Yeah.
Maybe a big surgery.
Yeah.
And then, or maybe the rest of the, you know, the 12 months, they want the best plan.
Yeah.
Because cost they think they're going to incur, and in case the baby's born, the baby automatically has the same plan mother has.
Yeah, because well, at my age, you know, I have 3 kids, and you never know, right? And if I chose, I'll choose platinum because I have 3 kids and I'm not 20 years old, right? So it's all depends on your situation and your need, right? That's really good. Good advice. Yeah, thanks. 咁有幾個 plan 啦，咁。其實我喺度問佢問題啦，咁如果platinum out of pocket 3,000蚊，但係佢 double 啫喎，咁其實計起條數嚟platinum 係抵好多嘅喎，因為個 coverage 係多好多啊嘛，又唔使俾咁多錢，但係俾 double， 但係佢 coverage 係3倍喎，咁你計條數其實好多㗎。咁但係Sylvia 就佢睇你自己嘅身體狀況啦、家庭狀況問題啦，譬如你 single 啊、好 healthy 啊，咁你就可能唔使用到 platinum，因為你睇醫生或者入醫院嘅機會唔係咁高咯。咁但係如果你年紀大啲啊，有小朋友嘅家庭啊，咁好多時小朋友好似我 cousin 咁啊，跌到個頭又要去睇醫生啊，撞親啊又睇醫生啊，咁我哋有陣時有啲膊頭痛啊，咁又要睇醫生，咁啊變咗睇醫生嘅情況係多咗。同埋你會用醫療嘅設備多咗，咁你咁就着數啲啦，買 platinum。Thank you, thank you.
Yeah, so a lot of foreigners, when they come to the U.S., sometimes they're not like us Americans here. Mm-hmm. We know that never have even one day of gap in insurance. We will always make sure there's no gap when we go from one plan to the other plan. Yeah. So I think a lot of foreigners need to understand that in the U.S., if you even have an accident and you go into intensive care, one night, we help the client review the bill. One night is $10,000. And there's barely any wiggle room for discount. Even if you say you want to pay cash, very small discount. So 10 days in ICU is $100,000.
And go broke.
Oh.
Yeah, but But with the insurance rate, we got a break, right? Yeah. Okay.
Yeah. If you have insurance, first of all, the insurance company have contract rate with hospital. So hospitals say $10,000, but the contract rate may be only $2,000, $3,000.
Okay.
But if you don't have insurance, you do not have the company backing you up, giving you contract rate. You pay the market full price.
Full price. Okay. Yeah. So Cynthia 會 give 佢俾一個好好嘅 advice 我哋，就係因為我哋local 咧美國人，我哋咧就唔會有一個唔會有一日係冇保險嘅，因為如果你嗰一日撞車啊，或者嗰一日有事咧，你就好大件事㗎啦。因為如果你入醫院咧，你隨時住一晚係要1萬蚊㗎。咁因為嗰係retail market price 1萬蚊，咁但係如果你冇俾保險咧，就你俾1萬蚊出嚟。如果你仲要10日咧，就10萬蚊㗎喎。如果你住耐啲，你隨時係破產都得㗎喎。咁但係如果你有保險之後咧，因為保險咧同埋醫院咧，佢有 contract 有 discount rate 嘅。咁如果你俾 market price 係1萬，但係你有保險可能係比同個 insurance 同醫院個價係2000蚊嘅時候，咁個歐學俾2000蚊，保險仲要包你80% 90%，可能你住一晚係俾100蚊，但係如果你冇保險，你係1萬蚊，所以你唔可以一日都冇保險㗎嚟到美國 ，OK？ That's really good advice. Thank you.
Yeah, so that brings us to another topic is when you would apply for your insurance. For people who are here already, annually, there is an open enrollment, usually from October until January. But many times since 2010, they always extend the open enrollment because a lot of times people are not ready, people are not done enrolling. Mm-hmm. So a lot of times it can go until February or March, but we don't know until the time comes.
Okay.
So open enrollment October, maybe until March.
Okay. 咁呢個問題咧就要幾時開始買保險啊，或者 apply 保險啦。咁咧通常咧個 open enrollment 咧買保險就係10月至到1月，咁但係有陣時佢會 extend 啲時間俾你㗎，咁啊多數有陣時 extend 到3月咁樣嘅。
And if other than that, once you are in your plan, you are locked in that plan for the rest of the year until the following October. You can make changes, but always take effect January 1st of the next year.
Oh, okay. 咁你買個保險咧，通常得1年，而嗰1年內咧你就唔可以變㗎啦，唔可以我今日想做高，聽日想做 premium 咁樣premium 咁樣，咁變咗你揀嗰個 plan 嗰時你要好小心咯。咁同埋通常都係嗰個 plan 去到出年1月，咁你先至可以再去由1月到1月咁樣咯。
So, but there are a few exceptions for people who can enroll outside of this window, this open enrollment window. One, if you just got married, you can always change plan, get new plan. Okay. If you move, maybe out of state from New York to California, you can change plan. Then you have a special enrollment. Move, marry, you adopt children, you have your own children, you can change plan. And most important for the new immigrants, when you arrive into the U.S. the first time, you have a 60-day window.
60-day window. Okay. So after the 60 days, you cannot.
You wait October.
Oh my God. So
yeah.
So can I buy the insurance before I arrive? Is it okay?
Usually not, because they need to know when you arrive into the U.S. That's when you qualify.
Oh.
Because coming into the U.S. from the date of arrival, you have 60 days. However, you can contact us first. We prepare all paperwork.
Okay,
Once you come, take a picture, and then we submit everything to get it processed.
Okay. Yeah, because it's kind of dangerous, right? I arrived the day I got an accident, what happened? And then sometimes it takes time to process. How long is the process to get?
If it's before the 15th, if you apply first to the 14th, you will get next month on the 1st. If you apply after the 15th, it will be the following first month. So you may wait 1.5 months if you apply after the 15th.
Oh my God. Okay. 咁Sylvia 咧就話通常去 apply 咧都冇 exception 嘅，但係有3個 exception。你去如果你 miss 咗嗰個 enrollment period， 你就可以譬如你啱啱結婚啦，或者你去你搬啦，由 LA 去 New York 或者 New York 去第二個 city 啦咁樣。第3個就係領養啦。呢3個情形下咧，你就有同埋你就可以唔喺呢個 October 度去 apply 都得。 咁如果呢啲新搬嚟嘅 immigrant 啊，譬如好似香港啱啱移民嚟咧，佢就有60日嚟咗之後，有60日內你一定要買保險。如果你過咗60日咧，你就要等到或者出年啊，或者等到10月啦，再先至可以買保險。所以一定喺呢60日買。如果你唔買，你就會好危險啦。咁如果你喺15號之後買咧，你可能要等多一個月零一個半月，你先至可以再買嘅。所以你嘅時間嚟到最好，第一步你乜都唔好做，揾下先知嚟買咗保險先。So what happened if I'm saying that if I come here arrive and I have to wait a month and a half?
Exactly.
What am I going to do?
So usually, even if you come, when you apply for insurance, you will at least wait 15 to 20 days, even if you apply early. Apply late, then 1 month and a half. So the best advice that we think you can take is buy travel insurance from us before you take off from your home country. At least buy maybe 1 month to 2 months of travel insurance. Very cost effective, not expensive at all, but it will cover you for any emergency, accidental accidents. It won't cover you for routine exams, but if you get into an accident, if you get injured, if you have a sudden onset of something, then you will be protected by the insurance within the gap.
Okay, so I can buy in Hong Kong before I come here, right?
Yes, we will issue you a travel insurance.
Oh, great. Okay. 咁因為如果你嚟到先至買呢個 insurance 啦，雖然你有60日，但係你有陣時都要等1個月或者個半月，你個 insurance kick in 先可以用嘅喎。咁你嗰1個月2個月點搞咧？因為你隨時好危險噶嘛，有啲咩事，咁你咪會冇 insurance 保險啦。咁佢就俾個好好嘅意見我哋。就係譬如你喺香港咁啦，你喺香港嗰陣時未嚟之前就幫insurance 買定呢個叫 travel insurance， 就買1至2個月，咁你有呢段時間起碼你都 cover 到，咁有啲咩事你都有時間等到去買保險啦。This is a really safe plan to do.
Yes. So another little few pointers is that, within a family, what consists of the family is mom, dad, and children. You cannot have your parents. Okay, so anybody who is your dependent under the age of 26, they can be your dependent, your children. Once they are older than that, they will need to go off on their own plan, which brings us to the conclusion that we cannot have our parents as our family plan,
Okay. 佢講緊如果你有小朋友個 family plan 係點咧？個 family plan 就係你小朋友26歲以下，你就可以under 你嘅 insurance。如果26歲以上，佢就要分開㗎啦。同埋你嘅父母亦都唔係 family， 只可以你直屬嘅子女先至係 family 嘅啫。要26歲以下。Okay.
And then a few things when you come here, first land in the U.S. If you are a new immigrant. Once you get here, of course, we want to see your passport, and we probably need to see a lease agreement, a home, property tax, some kind of proof that you are establishing residence in the United States. Because remember, this healthcare is for legal residents in the United States or in California. A lot of times because they know people will come here to take advantage of the system. They may not live here, but they have an illness, knowing that they can get the insurance without any review. Okay. So you need to have property tax, lease agreement, and you need to have one other form of ID, either driver's license or utility bill, something similar to that.
Okay. 咁佢話嚟到去申請嗰陣時咧，一定要有 passport 啦，咁亦都要有你 proof 你係住喺美國啦，所以佢又要可能要你嘅rental agreement 啊、lease agreement 啊，或者 property tax 啊咁樣，咁亦都要另外一個 ID 就好似 driver license 啊。咁我有好多問題都想問佢啦。如果呢個3個嘅即係證件都未必有咁啊，初嚟咁點算咧？Yeah, I got some question now. If say I just got here, I don't have my driver license. It takes me some time to find out how I'm living with my cousin. So what I'm going to do?
So usually what we would do, we would still submit the application right away with a passport. Okay. But even if you are living with your cousin, you still need to maybe put your kids in school. It depends on each family situation. There's always a way. If we do not have an answer right away, we can ask the carrier, give them the situation. They will give you a solution. If you truly are establishing residence here, you may have a bank account.
Okay.
So the carrier, depending on what your individual situation is, they will give you an option that they can accept. So always best that we communicate this to the carrier. They let us know before they come.
Okay.
And then we can help them assess the information and see what we need to pre-plan.
OK OK。咁啊 ，City 話係啊因為未必人人一嚟到會有driver license 有個揸車證啦，又有唔租到間屋啦。譬如好似我同我 cousin 住咁點算咧？咁佢話其實呢啲大家有得即係去討論啊研究嘅。最緊要係 prove 到你係 resident 係住喺度，佢因為好多人係人嘅，即係喺第度住啊，話唔係喺呢度住啊。咁佢只係想 prove 到你有住，譬如你有 bank account 啦，譬如你有其他證件啊、學校證明啦，咁佢係最好咧，就係你未嚟之前就同佢哋接洽，咁佢大家即係溝通得好，你知道你嘅 situation 係點啊，佢就會幫到你。等你嚟到咧就 smooth 好多，容易好多，唔會話有好多 liability 啦。
Right. So the biggest mistake a lot of times people do is they feel they don't have all the proof of residence, so they wait. But that's incorrect. Still submit the application because at least everything is in the system. It takes about 5 to 7 business days to even get the application in the system, somebody to review and ask for other documentation. So if you wait for everything to be ready, then your time is already delayed even more.
Okay.
Once
so I should or people should submit whatever they have. If they have the driver license, submit it. They have the passport, submit it, and then we'll work on other document later, right?
Yeah, usually passport and the application, at least get that in.
Okay. 咁佢話就算你冇其他 document 咧，就 application 同埋個 passport 咧都要即刻去 submit， 因為咧要7至10日去做呢個手續嘅。如果你等耐啲咧，你個手續又要耐啲。咁當你submit 咗 passport 同埋application 咧之後嗰啲再去揾都 OK 嘅。Thanks.
Okay. And then if anybody is coming here with their elders, like their parents, their own parents, if they're over 65 years old, then they cannot get insurance here. They will either need to buy travel insurance. They will either need to, if they're new immigrants, they can see how they can get Medicare. They will need the green card, but there's many criteria that go along with that. For instance, they need to have their green card for more than 5 years legally. Or if they need to have the government-sponsored Medicare insurance, they need to have reported tax here, at least a minimum of 10 years.
Wow.
So those all things that we also give, consultation to and help them to establish that. Because even if parents are 65 now, by the time they can get Medicare, maybe they're 70, 75, but eventually the older they get, the more they need healthcare. They should still plan for that day.
Okay, so you mean they need the tax, the income tax is the one you apply them or the parent, the one who is over 65?
Or some payroll tax. It doesn't need to be much, a few $1,000s a year. Maybe the child can, they pay the parents for some kind of work that they do, but they need to report tax and say, hey, I have an income every year, whether it's, babysitting, working in an office, clerical, do some filing, it doesn't matter, but you need to have some working points. Every year, each person can obtain 4 working points, no more than that. You need 40 points to be eligible for full government-sponsored Medicare. Okay.
So 如果你個 parent 係嚟啦，咁佢年紀大過65歲咧，係買唔到個保險嘅喎。咁咧要可能佢要買 travel 保險先啦，同埋可能要用 Medicare 先啦，或者要5年嘅income tax prove 到佢先至可以買個保險，因為65歲用 government 嘅 benefit 咧，你要 prove 好多嘢嘅。Okay, let me ask her a question. Okay, let me ask her. So if they come 65 over, they haven't worked here, they have no income tax, and they never worked before in the United States, and they cannot really get Medicare. If they can only buy travel insurance for 2 months. So what they're going to do after that?
It's going to be very bad. That means they have no health care. If they get sick medicine, it's all cash pay. So you can imagine that's a big risk. Now, if they have green card for 5 years, they're eligible to pay for their own Medicare insurance. However, paying for your own medical insurance, the doctor part, the hospital part, that insurance will probably be between $700 to $900 a month.
Wow.
Okay.
Wow.
But once you are eligible for government-sponsored Medicare, out of pocket, you probably pay $200 to $300 a month.
OK。OK，如果你個父母65歲以上有個 Green Card 5年咧，就可以申請Medicare 㗎啦。如果個 Medicare 係government sponsor 咧，每個月係200到嘅啫。但係如果 government sponsor 咧就係900。Well, I'm really concerned about that because if say my parents want to come over 65 years, they have to wait 5 years to get the green card. After that, they can buy insurance, and usually over 65, you need a lot of help. So that's the big risk.
Yeah, so a lot of times, many Hong Kong or China citizens, they have 重大疾病,
Okay.
the insurance from Hong Kong.
Okay.
So if they get sick, if they ever have a stroke,
they go back.
They can get cash from that insurance, and maybe they can use it in the US. But as we all know, US health coverage is very expensive. Maybe that money will not last very long. So if parents want to come, make pre-plans on how to talk to a lawyer, advisor, talk to us. We can help establish, because when we say paying tax, it sounds very complicated, but really it's not.
Oh, okay. That way you can work with it.
It's very easy to set up. It's just like a self-employed person. You can pay yourself. You can have a family business, but it's very easy to establish.
Or they can babysit my kid?
Yes. I mean, the reason for paying taxes because you pay, in your W-2, you pay Medicare tax.
Yeah.
You pay FICA tax. All this goes towards the government. And then after 10 years, the government will, in return, provide you with health care.
Okay. Okay, now I know, I understand why a lot of my friends' parents have to travel back to Hong Kong to get their tea done, to get anything done. I never understand. I felt like, why are you making so much trouble, Now I ding, thank you. Yeah, so 咁佢咧就話，如果你啲 parent 65歲以上咧，就最好咧就係嚟之前同佢哋大家傾下，因為雖然係好多 requirement， 但係佢哋都可以幫你係譬如 tax 嗰度點樣可以 report 啲 tax 啦，咁好多嘢都可以即係大家去合作啊，會幫你可以買到呢個保險，但係最緊要係同佢哋商量咯，唔好諗住65歲買唔到我就唔買啦，咁因為係好危險嘅，要冇個保險，而且65歲以上咧都通常都要即係要成日睇醫生噶嘛，所以唔好放棄，都要揾佢哋傾咯。Thank you. It is a good advice. So even though it sounds impossible, right? So what you tell me over 65, but it's still you can help them. So I think that's really good thing to know. They should talk to you anyway. Don't give up. Say, okay, I'm over 65. I'm not going to get anything, right?
Because usually before they come to the US, they have visited here before, actually. Okay. They visit, they want to check out everything to see if they want to come here. But, maybe that visit was already 5 years ago. So had they already start now thinking, hey, we're going to come here, let's do some pre-planning. At least when they come here, maybe wait only 5 more years, then you have the insurance. Of course, you need to have a very good idea which direction you're going. If you say, oh, I have no idea, then a lot of people still don't want to plan because they feel efforts may be wasted.
Okay. 咁佢就話最緊要係個 planning 計劃，譬如你未諗住計劃去之前，或者你去玩之前5年前未申請之前，咁最好就同保險公司大家傾下先，可以好多計劃可以做。咁當你真係決定去移民啦，5年後移民啦，咁樣咧就啲嘢會容易好多咯。This is really good. So the planning. If I'm 60 years old now in Hong Kong, I'm thinking maybe moving, so I better just go to you to plan it now before I really move there.
Yeah, but I guess to clarify, they would have need to already start some sort of immigration process because a lot of the people, when they do the immigration process, it's not 1 year, 2 year deal. Yeah. It take many years. Yeah. And then after they get some kind of US visa here, they already file taxes and then they still live overseas. However, the way they file taxes does not qualify them for Medicare. So we need to make sure the way they file the taxes is qualifying them because I meet many foreigner immigrants. After I talk to them about their insurance, I ask them, how are you filing your taxes? They already filed for 5 years, but not the correct way. They just
waste of time.
Yes.
Oh, I got it.
10-year become 15-year.
OK， got it。咁啊 ，Cynthia 咧就話最好咧，你就係、如果你係諗住移民啦，咁你年紀亦都比較大啦，譬如60啊、50幾、60啊咁你諗住移民申請嗰陣時咧，你就同一步就要同個保險公司傾㗎啦，因為咧當時你去做一個你個 income tax file 嗰陣時咧，即係入紙 income tax， 你係入錯咗嘅，咁咪變咗嘥咗好多時間。如果你第一步保險公司入啱咗佢嘅 requirement， 咁你到時嚟到申請咗，譬如你而家開始申請入紙，到5年後申請咗，你樣樣填得啱啊，到時就算你 over 65歲，你都可以買保險。但係所以個planning 啊，同埋一定要同保險公司傾咯，即係你申請移民嗰時，你就可以一齊傾啦。That is really good. So at least we know when people want to apply for immigration at the same time, they need to find an insurance company to talk to, right?
Yes. And then also, yeah, these requirements talk to us, but we help them to satisfy what the U.S. government wants them to do and to file. And it's not just for parents, because a lot of times it's the younger generation, the people who are 30, 40 years old who's immigrating, they're not thinking about their future insurance, so they're not filing correctly either. But the day that you come, since you choose to immigrate here, your retirement day will come.
Yeah.
So make sure that everything is aligned and set up correctly, then you waste no time. Because usually immigrants, they file taxes anyway. That's how they get their visa.
Yeah. So now we know it's not only finding a lawyer, right? We need to find insurance too at the same time when we're thinking about immigration. So it's good because a lot of people probably don't even think about it. They think insurance, okay, after that, right? Yeah. 所以Cynthia 咧就話即係好 strongly suggest 啦，如果你係申請移民嗰陣時咧，除咗唔係就係揾律師嘅，一定要揾保險公司傾咗先，因為如果你 file 你嘅 tax 唔啱㗎啦，咁你就嘥咗好多時間同埋亦都可能嘥金錢啦，咁你到時又買唔到保險啦，咁就會好大件事㗎啦。OK。
Yeah, so as far as health insurance, the only advice is get started early. Make sure you consult a broker you trust, that understands how all this works early on.
OK， 係啦，咁regarding 買健康保險、醫療保險啦，就一定要一早就揾定個保險公司傾咗先啦。最好你申請移民嗰陣時就好傾定啦，咁咧變咗咧就令到你又唔會嘥時間，又唔會嘥錢㗎。Hey Cynthia, thank you so much for your time for this section. We will also want to know about home insurance, auto insurance, and all the other stuff too. How about we come back tomorrow and talk about it? Okay? Thank you. 多謝你哋收睇我哋嘅都市閒情啊！記得如果你中意嘅咧，記得俾 like 我哋同埋 subscribe 楊 Sir 頻道啊！如果你有啲問題嘅咧，記得留言俾我哋啦。